Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
We'll claim your life.
A quick note from the editing room before we dive in. I recently had the honor to sit down with Leon and Mercedes Wells. In this episode, I'm speaking mainly with Mercedes, with her husband Leon by her side, but he was just as much a part of this experience as she was, and his insights are incredibly impactful. One thing we didn't get into during our conversation was their advocacy for the Wells Act, which is being led by U.S. Representative Robin Kelly in Illinois. I'll have more information in the show notes if you want to learn more about that work. Now on to the episode. Eight minutes. That's how long it took for Mercedes to give birth after a hospital sent her home and told her she wasn't in labor. Today, she's here to share what happened and what we can all learn from it. I'm Dr. Bayo, your health advocate and a board-certified family medicine physician. I bring the work I do as a doctor with me on the news, on social media, and here on this podcast. And this conversation is personal for me too. If you're not in a place to hear about medical dismissal and birth trauma, please come back when you're ready. Today's episode is special. I typically bring on health content creators, but this time I'm sharing the story of someone incredibly brave. Mercedes' story went viral after she was discharged from the hospital while actively in labor and gave birth in her truck just 8 minutes later.
Mercedes Wells arrived in clear distress after hours of strong contractions. Staff focused only on her dilation number, decided she wasn't progressing, and discharged her. They did not track her contractions, did not reassess her pain, and did not listen when she said something was wrong. 8 minutes after being forced out, her labor collapsed into crisis. Her husband pulled over their truck as the baby crowned, delivering their child on the roadside while Mercedes screamed through pain that should never have been managed alone. They then drove 30 more minutes to another hospital.
I feel deeply connected and defensive of Mercedes and her experience because I know what it's like to be dismissed during the most vulnerable time surrounding birth. After I gave birth, I almost died. I knew something was wrong. I told them something was wrong, and I wasn't believed. So this conversation is personal, and I know for so many of you, it's personal too. Let's get into it. Mercedes, thank you very much for being here and for being willing to share what happened to you. Can you take us back to that day and what you were feeling and kick it off with that moment?
Yeah, so when we were in that hospital, walking into it, we thought we were going to deliver our baby there, but we didn't feel welcome to start with. The nurse, she came into the room and said, "Hey, go ahead and get undressed. I'm going to check you. And if you're not past 3 centimeters dilated, then we're going to let you go." And so I did that. She told me to pee in a cup, and I asked her why. And she's like, "Well, that's for the drug test." And I just don't remember having that experience before, having my other 3 children. When I went into labor and stuff, I never experienced that before. So already there were signs, but I kind of looked past it because I'm just like, I'm having this baby today. Let me just focus on bringing her here, safely. That was my main concern.
And the fact that you mentioned you immediately felt you weren't welcomed. There's a signal that we all feel when we know something isn't right. And from the jump, when you came to that hospital, everything wasn't similar to what you had experienced before.
Right. And my husband also noticed, my mother even noticed that something was weird. So we began to ask her questions. We're trying to get to know this nurse because her energy was not welcoming or caring. She was not compassionate of my pain in no kind of way. She dismissed the fact that my water had broken in the bathroom. My husband told me, babe, she said that she's trying to discharge you if you're not past 3 centimeters. And I'm just like, can't be. She meant I'm going to labor and delivery room. And he's like, no, that's not what she meant. And I began to realize that that's what she meant when she came back in and said that, you could take a walk around. And if you're not past 3 centimeters, we're going to discharge you. And the last time she checked me, she felt the baby's head, but disregarded that as well because she still said I was 3 centimeters. And I knew that couldn't be the truth.
Right. And when your husband said her water broke, she's in labor, do you remember exactly what that nurse said to you? And if you don't, that's fine. But I'm just curious, when you had, shared this is happening, what was the response?
Okay. That's it.
That's it. No other
Mhm.
follow-up, nothing.
Said okay. And then she said that, they're going to monitor my contractions. And she put me on the monitor. And we monitored for hours. I walked the halls. My mom timed my contractions. And during the time of walking is when it was back to back, 1 minute apart. And when I got in bed, it spread it out a little more because I was resting, but still going through my labor. It went back up to 6, 7, 8 minutes. And that's what she went by and said, I told the doctor, about your contractions and that you're still 3 centimeters dilated. So the doctor said to discharge you. And I told her, I'm like, I don't feel comfortable leaving. I'm actively about to have this baby. I feel her coming down. You felt her head. I don't want to leave. Is it policy that I have to leave? And she's like, yes, you have to leave when the doctor discharges you. I'm like, so I can't choose to stay regardless because I don't want to leave. I don't feel comfortable leaving. She said, no, you have to leave.
So in that moment, you're on the bed. I'm just going to paint this picture. You've been monitored. You've been asked to do a urine test. You already feel unwelcomed. And you know that the nurse has felt the baby's head. So then you haven't seen a doctor. I remember you have shared that many, many times that you never once saw a doctor, and the nurse tells you that they're going to discharge you. Can you walk me through that moment? I mean, I know just in itself, knowing all the things that are active labor, but can you share what happened right after that?
I was afraid and I didn't want to leave, but my husband encouraged me that we were children of God and just know that God got us and everything was going to be okay. Let's go to a hospital that will welcome us. And so he went and asked for a wheelchair because they didn't offer one. He walked out to the nurse's station and asked for a wheelchair, and they brought it to the nurse's station. They wouldn't even bring it to my room. So my mom and husband had to walk me to the nurse's station.
And you're taking off. So you get off the exam table. Your husband and your mom have brought a wheelchair. Like you mentioned, they didn't even offer. You sit down. And when we see that footage of you being pushed down the hall and seeing you in active labor, can you share even more? I mean, I could see it physically, I could see, but I would love to know, internally. And I would love for you and your husband both, because this is a pair, this is a team, of what was happening in that moment.
I want to backtrack a little bit. When they walked me to the nurse's station. The nurse that was seeing me, she didn't come back out. She had two other nurses help us. So the nurse that was holding the wheelchair just sat there, stood there and waited for me to sit down. But I was wailing out in pain standing there. And I was looking at the nurse's station with all the nurses there. And they were just looking at me with blank stares with no one, not one person. It was about 8 people, nurses sitting there at the nurse's station. No one showed any type of concern or tried to advocate to say, "Hey, you guys see her in pain? Let's backtrack a little bit. Let her calm down. Let's manage her pain before we discharge her or anything." And I was wailing out to the nurse's station for someone to kind of help me, and no one responded in no kind of way. So I sat in the chair and she got to rolling me right away. Like there was no compassion. And she was rolling me to the elevator very quickly. Like, I had to tell her to slow down. When we got off the elevator, it was crazy because there was a security guard standing there waiting on us to escort us out of the building. And we were completely calm. We were, stand up patients where we were being nice to the nurse the entire time, regardless of me not wanting to leave. I never got upset with her. I never got loud with her. My husband, everyone was so calm. So it was no reason for security.
And I remember hearing you, as you mentioned, you were going over a bump and the sliding glass doors had opened. You can see you're crying, you're in pain. And I remember you saying very kindly, even in the state that you were in, do you have to push so hard? Do you have to go so fast? I remember hearing that. And that really reflects, even though you're in pain and distress and being discharged when you shouldn't have been, the level of kindness, the level of respect that you shared, although you didn't get it in return. And I'd love for, your husband to chime in as well, because this is, again, the team effort. Can you walk us through what your thoughts were as you see your wife getting discharged and then seeing her cry as you guys are exiting the hospital?
I was hurt. I was very hurt. Um, Being a protector of my wife and family it was a very challenging moment for me. It's to this day I'm hurt. I'm hurt about it. I'm upset about it. It's so sad because we're human beings. We don't deserve that. We do not deserve that. We are very kind people. We're children of God, and it's like it's a nightmare, to be honest with you. And I feel like we got robbed. I mean, we got robbed of the experience. We did everything right. We called ahead of time, even though we was in the area and that was the hospital that was closest to us. We called ahead of time. When we got there, my wife left out, but she was sent to a triage room. She wasn't sent to a labor delivery room.
Yeah.
My wife last pregnancy, I'm sure they see her charts. She had baby at 38 weeks. She was 38 weeks this time when she had baby. She was in labor for 4 hours last time. This time she was in labor for 6 hours. But still, they saw her charts. They should have took it serious from the time we got there, and they never took it serious. Like, her voice is not heard from anything she said. Her voice is not heard, and that shouldn't be. If you're in the medical field, you should love people. That's just what it is. You should love people, and you should have a different compassion for people than the average person, because that's the healthcare system. You're here to care for others, and it's just sad that not one person was able to advocate the same thing, say, hey, stop, listen, she's in pain. And like my wife was saying, like, not one person. I mean, it shouldn't matter race, creed, religion. It should not matter. We're human beings.
There are so many powerful things that you mentioned. And the fact that you mentioned when it comes to the word health care, it is to care and to provide health and to help people. And that wasn't given in any area. The other thing I want to really amplify is you have multiple people watching this happen from the time you are getting discharged, and people can see Mercedes' face. They can see that she's in pain, and no one stands up and says, this is wrong, that this is what's happening here shouldn't happen. And it's appalling because we are human beings, and this system failed you. You gave birth 8 minutes after they told you that you weren't in labor. And as a doctor, I know that if you've had a baby before, you are likely to go into labor quicker or follow the same kind of pattern that you did before. After you got in the car, Mercedes, can you share with me, you guys are in the truck, on what happens next?
So he pulls off, my husband pulls off. But before that, I have to mention they pushed me outside while he was heading, because we were walking together, right? He had to go get the car and pull it up for me. They pushed me outside to wait in the cold. And I had to tell her, can you please back up and take me back in? It's freezing cold out here. It was 6 a.m. in the morning in November. So I was even stunned at that moment that they were treating me so cruelly. So he came and pulled up, and then he took the wheelchair and pushed me out himself because it was so much cruelty at every point in this situation. And it was just getting worse. And my pains were also getting worse and worse. So by the time I got in the truck, I told my husband, babe, I have to push. Please help me pull my pants down. We were on the expressway because the expressway is very close to this hospital. So as soon as you get out the parking lot, you go down the street and you hit the expressway. So we were on the expressway. It was around maybe 5 minute mark or so. And I told him, help me pull my pants down. He still has his left hand on the wheel and his right hand is helping me pull my pants down. And I'm pushing already. So the baby, he said he seen the baby's head as soon as he pulled my pants down.
Yeah. So when I pulled her pants down, I see baby head. I immediately called 911. And asked them, what should I do? What should I do? Their concern was not what should I do? Their concern was where was I at, which is understandable. But I mean, the baby is about to get delivered right now. I don't have time to wait on the ambulance. So what should I do? Um, and that was a very frustrating call because it was no help. But it seemed like there was just me and my wife, and God, honestly, because He gave us the strength to do what I had to do and she had to do at the time. And we definitely had angels camped around us. It was a very scary moment. Um, I was very fearful for my wife and the baby because I'm not a doctor. I don't know what's right. I don't know what's wrong. So that's our work truck. It's sanitary conditions. Like I said, I felt we got robbed. Like we got robbed of the experience of having a beautiful labor like we expected. This is my dream queen here. This is my best friend, and it's just to have that experience. It just words can't describe how sad it is. It's very sad that we got treated that way.
It is. And there's no words of that can even come close to an apology, a we are sorry. None of those words will ever fill the void and what happened as far as being robbed from an experience that you should have had. And the fact that you went to the hospital to get the care that you should have had and was dismissed is just unforgivable. There is one common pattern that I do see, and I would be remiss if I didn't recognize it, and that is your level of faith and all of the words that you mention, a child of God and angels surrounding you, which helped protect you and your queen through this. And that being said, it doesn't excuse what happened, but I do feel a lot of us pull on the things that are near and dear to our heart that keep us going. And that was that angel that was with you
But
throughout that whole time.
yes, yes, yes. I mean, yes, yes, indeed. And if you even look at the video, we was playing worship music when I put my wife in the car. Were playing CC Winans song "Worthy."
Yes.
On the way there, we was playing worship music. Before wifey had baby, that song was playing. So that's like that song plays in our heart very dearly when we hear it because I mean, God is worthy. He's worthy of it all. And I mean, He really brought us through and really helped my family, helped my wife, and helped my baby to be safe. And it was a scary moment. But my wife is such a trooper. I saw so. What happened was when I saw baby's head and she had to push again. I literally I didn't know why I did it, but I just felt like I had to do it. But I literally had my two fingers and inserted them at the bottom and kind of wrapped around my baby's head. And as she pushed, I pulled down, and the baby came right out. And I kind of cuffed baby and cuffed her head and put it on wife's chest. We had her labor bag in the back with the blankets, the clean blankets and stuff. So I quickly grabbed a blanket and we wrapped baby up, and she held baby and started rubbing her. I told her to rub her chest and rub her face and rub her back and get her blood to circulate because she was real pale. And it was just, I don't know why I had her doing all that, but it was just something in my mind. This would need to be done. And
Right.
because baby was silent for a second, and I was very nervous. And we know a baby needs to cry, so I was like, rub her, and rub her face, rub her. And yeah, she rubbed her, and baby started crying. And yep, and we rushed to the other hospital and called. I hung up on that 911 dispatcher and called him. When I got closer to the other hospital, because it was a 30-minute drive from the other
Mm.
hospital. So, and we didn't know, like, during that time is it was critical for baby and wifey. Like, is there anything that we missed or we should have done or should not done during that time? But yeah, like I said, it was a 30-minute drive from one hospital to the other. And so when we got closer to the other hospital, called 911 again and told them I was on the way and please to inform the police and inform everybody that we're coming. And they did, and they informed the community hospital. And when we got there, they had 15, 20 people outside with blankets and all around the emergency room and treated us with a lot of love. And really helped us.
And just listening to my husband talk about how he had to coach me to make sure the baby was breathing and to clear her airways and to wipe her face off and to pat her back and to rub her up and rub her up. I remember it like it was yesterday. He's coaching me all the things that the doctor or the nurse would have done if they allowed us to stay in the hospital. And it just reminds me of the experience that we went there for and what we were put out on the road to have to do ourselves. And it's hurtful. And it breaks my heart to think of.
Sorry. Sorry.
And my heart breaks for you and your husband because you are absolutely right. You should have had that care. You should have had the feeling right when you walked in that hospital of being welcomed and feeling joy to be able to bring your baby into this world. And you knew that instinct didn't feel like what you had had before. And to know that it didn't happen and what could have happened as far as the complications in that truck, as your husband shared, the unsanitary pieces, he's driving, he's got one hand on the steering wheel and helping you, try to pull down your pants. It's a real life situation of bringing new life into the world that could have brought an unfortunate event, but God stepped in and helped your husband and you together, bring this baby into this world. And how is she now?
It's touch and go. It's touch and go right now. She had an episode with seizures, but we're taking her. We have to take her to another hospital and another doctor office to see another specialist. But just pray for us. It's definitely touch and go. I want to back up this a little bit. When we were in the car, I do remember one thing. Um, and I'm like, my wife is such a trooper. But after she pushed baby out and she got through that pain and was relief, and she saw baby, she was like, "Healthy baby girl, healthy baby girl." And I remember her saying that, and I know that's just what the nurses normally say. When the babies come out, and she wanted that experience so bad, so she had to give it to herself. You know, it was just her mental, like, just had to get it to herself, like, and I remember that it's like very, very clear.
And let's also talk about the fact when your baby was born, you have a 30-minute drive from the time she was born to the hospital. And although you could hear her cry, there's something to be said about a healthcare professional, whether it's a midwife, whether it's in the hospital, a doctor that can provide that reassurance in that moment that your baby is okay. And that drive from the time she was born, you didn't have that. You didn't have that. You heard her cry, but you weren't able to see the stethoscope that's placed on your baby's heart to make sure the heart is beating well, to know that the lungs, that she's breathing. So all of those things as a doctor, I'm thinking that as well, of those missing pieces for reassurance for parents.
Yes. Yes. It was very, very, I mean, I didn't know. We prayed. That's all we can do was pray and, ask God to give, my wife strength, to give her baby strength, and help us.
Well, I open this show with sharing the words I use, very protective and defensive, and I say that because there is a shared sense of understanding and respect that I have for you and your family. And it's unfortunate that trauma can sometimes bring people together in a way that no one else understands. And that is the fact that I nearly lost my life in the hospital that I worked at, that I still work at as a medical director, where I had just given birth and I had my C-section. And I knew about 30 minutes later that something wasn't right. And to your point, Mercedes, when you're like, I know when I walked into this hospital, something isn't right. The way I'm being treated, the way I'm not being heard. And I said, something's not right. I wasn't able to speak. I was having blurred vision. And I was told by my nurse, Bayo, you look fine. More time goes by and it starts to get worse. And then I start to feel pain that I'd never felt before. And I'll never forget, she was like, your vital signs look fine. You look normal. And if it wasn't for me continuing to push and my husband, there's another Sharon, asking him to call my doctor. And I got lucky because my doctor's phone number was in my phone. He called and said, there's something wrong with Bayo. I need you to come and see her. And what happened next saved my life, because when he came in, he knew something wasn't right. I was taken to the operating room. I was found to be bleeding internally, and I got transfused multiple units. And then I was hospitalized. But in that moment, I knew that I nearly lost my life because I wasn't believed. And so that's why I'm so honored to first share your story, even though I wish this wasn't a story to share. But what we can do is continue to advocate and tell these stories, because we know that it's not right and that this shouldn't be happening, but it is happening.
Yeah.
Yeah.
Yes, indeed.
Yeah, and that was the problem. Like, I realized at that moment that this is not just me, because not too long ago, before me, days before me, I seen this happening to another woman in Texas. The
Mhm.
neglect, the not listening, and in the healthcare at the hospital. She was at the hospital with the nurse that was treating her cruel, just like my nurse was treating me cruel. And I'm just like, how often does this really happen and people don't get it on tape? It just made me think, like, this must be really common for them to act this way towards us, and so naturally and easily. It has to be something that they do all the time.
And it brings into light the fact that there's a statistic that we hear about Black women 3 times more likely to die during childbirth or shortly thereafter than our white counterparts. And we hear the statistic over and over. But to your point, Mercedes, when you see that video footage, that's when, which is unfortunate, it comes into light where people are like, wow, this is happening. And it is. Black women are dying. But it isn't until they can see a video that shows someone in distress, and it shouldn't be like that, that it comes into play. And that brings me into, both the woman in Texas and then you're in that room and you see all these people who can see that you're in distress. And I want to highlight what should have happened. Right away, when you walked into that hospital, there should have been a welcome of, oh, we're so excited to see you. Let's see what's going on. Let's check you and baby. That's what should have happened. And then next, setting you up on a monitor, checking the baby, check your cervix. And although there are these protocols that are in place, because I've been hearing, and you hear a lot where people are like, oh, the protocols, they didn't check the box, they didn't do this. Well, let's unpack that a little bit. She checks your cervix and she puts you on a monitor, and you share that your water broke. There's no sort of action or listening to that. There's a check a box of, we checked your cervix, you're not in labor. And when that happens, we no longer have that humanity to understand that people are not a checkbox. Let's look at what is in front of us. You see a woman who is in active labor. You read her previous history of having babies at 38 weeks. All of those things should have had those providers go beyond a checkbox. And I just want to highlight that. All of the areas that something could have changed and it didn't.
And that's how I feel too. It's like I guess it's protocol for this and protocol for that. And it was all about protocol and how things work and not the care of the patient, which was me at the time. You're supposed to care for me and make sure that you stabilize my pain at least before you want to send me home or, give me more time. I've never felt rushed through my labor. I've had a labor that was 9 hours before, and she didn't even give me a chance to reach 9 hours. I was there for 6, but she actually wanted me to leave at 2. She was trying to discharge me, and I asked for more time. So I asked her for that time, and it was even supposed to be longer than that. She had agreed to give me even more time than that and changed her mind. Came to the room and said, okay, we're going to check you now and get you discharged because she did not want me to be there. And it's just unfortunate that, she took it that far to push me out of there and have us have such an event that it's going to be with us and the damage and trauma that's behind it. We're going to feel that. We're going to have this memory instead of a extraordinary memory of being happy and celebrating our child in a comfortable place. And it's just, I'm just tired of the feeling of having to be strong. And I feel like that's what they do to us. They say, oh, the baby's okay. So it's okay. It's not okay just because the baby's okay. I should have never been treated like less than an animal. So no, it's not okay.
And baby's not okay. I mean, baby has seizures, and that might never happen if we had a regular labor.
Mm-hmm.
Yeah.
So we don't know.
And it's not okay to treat the mom the way you were treated. We talk about baby, which is important too, but mom and baby. So when you're in the hospital and you can see that you are crying and that you are in distress, the fact that even though she wanted to say that your cervix was 3 centimeters, you can physically see all of the signs of labor within a matter of seconds. When I saw that video, I'm like, as a doctor, I immediately would have been like, oh, let's go. Let's go onto the labor and delivery floor. Let's hook you up. Let's get everything ready for you and baby. And that didn't happen. And the other thing I want to mention is those memories that you have been robbed from. It isn't just that one time, like you mentioned, but I want to give an example of that. Every time she has a birthday, you will remember this delivery. And I want to highlight that for people who are listening, because I can say, I know for every birthday for my youngest, I remember. It's like it was yesterday of how I was feeling in that moment when I knew something was wrong. And that's something that needs to be discussed over and over.
Yes. And that's why we're pushing for a change.
Yep. And we will continue to push for a change. So now, as we've talked about all of the issues and all the things that will still happen, and I also want to honor that I am so sorry that, your baby girl is having issues. So I want to hold space for that and also share that I'm hoping that she gets answers to the seizures, that everything that is happening. So I just want to make sure I mention that right now.
Thank you.
As we talk about all of the things that transpired with your birth and what's happening now, I want to talk about some things that are available when it comes to what we can do in this moment until the system is fixed, until things improve. When someone who is 8 minutes away from giving birth gets sent home, we're not talking about a misdiagnosis. We're talking about dismissal on all levels. We're talking about healthcare providers not listening. And here's the hard truth. This happens disproportionately to certain women, Black women, young women, women who've given birth before and told you that they know what their labor feels like. And when it doesn't fit into that healthcare provider's perception or idea of what distress or labor looks like, it turns into what you hear with Mercedes' story. Mercedes, do you have any advice for someone who is going into the hospital? They know that they're facing this level of dismissal. Is there any advice both you and your husband have for someone?
Well, my advice would be when you prepare at the end of your last trimester and you prepare to go to a hospital that's in your birth plan to have your baby at a hospital, do your research of the surrounding hospitals that you may be around during those last weeks. Do your research and look at the reviews and see if it's a good place to go. Because after I had that experience, I looked at the reviews on that hospital and it was horrible reviews. People that had their baby there and they were not listened to and they were dismissed and they had very bad experiences. Had I known, I probably would have tried to go somewhere else. So just do your research on the surrounding hospitals and make sure when you do go to a hospital to deliver your baby to have people that support you and love you and that would be the most caring people for you that love you the most.
I love that. Just being able to have someone with you that has your interest, your best interest at heart. I often say when you don't have a voice, you want to have that person next to you that will have your voice for you, that knows your voice. And the advice that you gave first, doing your research to find out if you can, and I understand not every time is that available in that moment, but if you can comb through and see the reviews or what other people have shared about that hospital that you have gone to. The second one is knowing your rights, which you tried and you shared, I know something's wrong. I don't want to leave the hospital. And you still were met with a level of dismissal and discharge. But just reminding people that you do have rights and you have the right to stand up and say, I don't want to leave when you are faced that. And the third one I always like to highlight is trust yourself because you know your body best and you know when something isn't right. And so just reiterating those three things are really powerful. The other thing that I wanted to highlight is two resources. And I'm going to start with this is not sponsored. There is an app called Earth. And this app is specifically for Black and brown women. And they purposely removed the B because for them, and I agree, B can stand for bias. And that is the bias that happens in the care that Black women are given. And so Earth is the only app where you can find prenatal, birthing, postpartum, and pediatric reviews from Black and brown women. And I'm not affiliated with this organization. I don't have any sort of connection, but I do know that they are helping Black and brown women be able to know more about different hospitals and different experiences. And the second one is the free resource Clinicians Who Care, which is a resource that's helping people around the world know more about different doctors in all specialties. I just wanted to highlight those two resources for people. As you mentioned, the more you know, the more you can do something about it. Had you heard of these before, Mercedes?
No, I have not. And that's wonderful that we have resources to tap into. That's wonderful.
Well, thank you, Mr. and Mrs. Wells, for joining the show and taking the time to share your story to help more people. It has been a true pleasure and honor to be able to share your story and help in the plight that we will not stop to advocate.
The healthcare industry, the most important part about what you guys do is to lead with love, and that's the biggest thing. It's a little bit of love in the situation we wouldn't even have one. Just a little bit. It doesn't cost to love. It doesn't cost to care, and as healthcare provider, your choices are very critical. It could be a positive or negative effect on your life or somebody else's. So it's just always to lead with love. Thank you for
Thank
having
you,
us.
Dr. Bayo.
We really appreciate you.
And here's what we need to change systematically. We need better training on implicit bias. We need to realize that protocols are just protocols. And when you forget to honor the patient in front of you, they do no good, but what they can do is harm. So we need healthcare providers who will listen, who will believe, and see each patient as an expert on their own body. To everyone watching, this maternal health crisis is real, and it's hurting women either through trauma or death. Black women are 3 times more likely to die from pregnancy-related causes than white women. Women in rural areas have less access to care. Women across the board are being dismissed and disbelieved. But we can change this through a collective voice and continuing the conversation. We can advocate for more. We can believe women, and we can trust that they know their bodies best by creating a system where no one has to give birth in their car because a hospital sent them home. Did something in this episode click for you? Share it with someone who needs to hear it too. Because here's the thing. The more you know about the birth process and your rights as a patient, the better you can advocate for the safe, respectful care you and your baby deserve. You've got this.
Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.